Well, a real sad story out of San Diego. Junior Seau, the longtime San Diego Chargers and NFL linebacker, dead in apparent suicide, a self-inflicted gunshot wound to the chest, just a shock to his family and friends. He was in his early 40s. Dr. Rob Dickerman with us, neurosurgeon, talking about the history of traumatic brain injury. Now, in Seau's case, we don't know for sure that he had a series of concussions. An NFL linebacker, you could probably suspect he probably did.
Sure. And what I guess the public needs to understand is this chronic traumatic encephalopathy is just a new name for dementia pugilistica or punch drunk, which we used to talk about. So it's all post-mortem diagnosis. We have to have their brain and actually analyze it to say this is what they had.
Right, and there were a couple of recent, in fact, within the last year, two other former NFL players, Dave Duerson, who played for the Chicago Bears, and Ray Easterling, who was a safety for Atlanta, committing suicide, same manner, gunshot wound to the chest. In Duerson's case, specifically said, I want my brain studied. He knew what was going on after his NFL career.
Sure, it's very interesting. It's actually becoming more aware to the medical community as well as the public, where it looks like when you look at their brains in terms of under the microscope, they're developing an Alzheimer's type of neurodegenerative disease from the chronic repeated head trauma. And it just takes an insidious time, similar to Alzheimer's, slow onset, behavioral changes, motor change, they'll start getting twitches, and then comes the dementia.
And we've seen this in hockey players, we've seen it in boxers, the same symptoms, and in many cases, the same, what they view as the solution, suicide.
Yes, sir. Yeah, right now we don't know what to do with it, and we don't know how to stop it. We don't know how many concussions it takes, how long after the concussions does it occur.
If I'm a parent and my little boy wants to play football, my little girl wants to play soccer, or what do I say?
I think right now it's a little early for everyone to panic. Genetics definitely plays a role in this. We're seeing, just like with Alzheimer's, if they have a certain genetic link, then same thing we see in these football players post-mortem, 50% of them had a specific gene that would lead to this type of dementia anyway. So are there people that are predisposed to this? You know, and is it eventually going to become to where we do genetic testing before you play these violent sports?
Right.
I don't know if we're there yet.
And yet there's a very expensive equipment, and the equipment manufacturers, for a lot of reasons, not just to make money, but also for liability reasons, doing their very best to protect heads from that kind of injury. But there's no perfect solution. No,
sir, there's not. And the NFL's doing a good job about, they're protecting the quarterback, protecting the head-on-head hits, and so we're making changes. I just think it's gonna slowly change and evolve as we learn more and more about the disease.
And in some cases, it is not what you'd see as a full-blown concussion that causes the problems. That you can be a sub-concussion level where the kid, the player, might come out of the game. You look them in the eye. You ask them, where are you right now? They're perfectly fine. You put them back in, but they have suffered a sub-concussive level of damage.
That's exactly right. If you look at most patients that have had a head injury, or football players, boxers, they're not out for 5 minutes when they hit these. What we see in neurosurgery are these severe head injuries where the patient's unconscious for several minutes. These repeated slow hits is the key. That's what's leading to this slow, insidious onset of the disease versus a permanent brain injury that can occur with a baseball bat to the head or some kind of traumatic event that's instant.
Right. Okay. Well, great advice. And again, for the parents, all you can say is watch your kids and be careful. You certainly don't want to hold them out of all kinds of activities.
And follow up with a doctor if they're ever injured.
Okay. Great advice. Thanks very much.
Thank you.